Welcome to the Off Leash Podcast with Dr. Pete. I am your co-host, Molly Van Vranken, and we're so glad that you joined us for today's show. Remember, we're not here to say what you want us to say. We're here to be an advocate for your pet. I am sitting across from Dr. Pete. I'm going to let you introduce your friend.
Well, it's one of my favorite people in the world, Dr. Tom Eberhard. He's a veterinarian from the town next to ours. We're in Battle Creek, and he's in Kalamazoo. But Tom and I have a lot of interests that are identical. We're both veterinarians. We both like to play basketball one time in our lives. And
Did you play basketball against each other?
No, with each other a few times, but not against each other.
I don't think you guys would be friends if you played against each other.
He probably wouldn't be here if we played
you're kind of an asshole.
Yeah.
You're kind of an asshole when you play basketball.
That's what they say, you know. But Tom's a hell of an athlete. I just go do what I do.
Do you play in the Senior Olympics too?
No.
I'm kind of retired now. I'm basically a golfer and pickleball player now.
Okay.
Off the hard court of basketball.
Yeah.
Love that.
But I went to it's kind of fun. Tom and I went to a dermatology meeting one time in Florida, and your mother and I and I think I don't.
Diane
think,
was with us.
Diane,
Yeah.
Anyway, so they teach you stuff in the morning, and in the afternoon they have events. So Tom goes and wins the tennis tournament, and then the next day he goes and wins a golf tournament. So I had all these people here, and Tom's kicking everybody's rear end, doing all these athletic things. They had free beer there. That's what I was dealing with. So Tom didn't get in on the free beer thing, but he got in on the golfing and the tennis. And so I'm always envious of somebody like Tom that's a natural athlete that, I think he works at being good at things, but I don't think he has to work as hard at it as a lot of other people. So
yeah.
Let's just say that.
Thanks for the compliment.
Yeah, that's about as close as I'm going to ever get to doing that.
That's about as close as I've ever heard him give someone a compliment.
Yeah.
So kudos.
That's
We'll make it a love fest for the first 5 or 10 minutes anyway. But Tom and I do have a lot of other things in common. When we both got out of school, I graduated, probably 6-7 years ahead of you, maybe?
I was 1980.
Yeah, and I was 1974, so 6 years. And so, but we both went and worked in mixed practices, which meant we did large animal and small animal both. So Tom went to work in Wisconsin, and I went to work here in Michigan. And then, but Tom was it was a neighbor here, and so I don't even remember how we met each other, really. Do you?
I was kind of in between my job and then building my own practice, and you heard that I was kind of not doing much while the practice was being built, and you needed a veterinarian, so you hired me for about 4 months to help you out.
It was more than that, wasn't it?
I think it was just kind of about 4 months.
Oh, you worked with him?
Oh, yeah.
And you're still friends?
Yeah, at Dickman Road, yeah. Back with Gary and Pete and I.
Yeah, so
he's terrifying to work with.
No.
I worked with him for 2 years.
Your problem is you don't like to be made fun of. And down there, that's all we did was you and I and Gary made fun of each other all day. And then we went home with a stupid grin on our face, and I enjoyed working with Tom. Tom works hard at being a really good veterinarian, so it's somebody you can bounce your cases off of, and he'd bounce his cases off us, and I think to a certain extent we kind of looked at things in a similar venue. Both Tom and I, and Dr. Ellis for that matter, were willing to try new things or different things, and
weren't afraid to take things on.
No, weren't afraid to take things on, and that's and nowadays when kids get out of school, they're kind of worried. I don't want to get sued. And I'm not sure that ever crossed our mind. I think we told the clients what we were going to do and why we were going to do it. And it was like, have at her, Jack. And we did. And most of the time, things turned out reasonably well.
How common is that to get sued by a...
I've not been to court before. So, I think it happens. But I think it happens probably because people lack the communication skills to tell people, here's what I'd like to do. Here's what I think we should do. And if you give me permission to do this, otherwise I can send you to someplace else to send you referral practice. But sometimes people are limited in their funds and everything. So we're willing to take a whack at a few things, and which we did. And that was your mantra too, I think.
Yeah, for sure.
Yep. And then after Tom left us, he developed an interest in dentistry. Tell us about that.
Well, my first job was up in Beloit, Wisconsin in a mixed animal practice, and it was just the owner of the practice and myself. And, so we did horse work, and he hated floating horses' teeth. And that really was where I got started in dentistry, was with horses, because he hated to do it. He turfed it off to the new graduate. I kind of embraced it and ran with it, and actually went out and spent some time with people that were good at doing it and developed that skill and actually liked it. So
for our listeners that don't know, explain what floating a horse's teeth are.
Okay, so horses, the way their jaws are, and when they eat and they grind their food, they wear sharp edges on the inside of their lower molars and the outside of their upper molars. So they get these knife-like edges that form over time when they eat, and you have to take actually rasp or files and file these sharp ridges down.
Like power tools.
Well, back when I did it, it was all hand tools.
Oh, really?
So I hand rasped them.
Armstrong stuff.
Yeah, so that's why a lot of veterinarians didn't like it, because it was hard work.
I was going to say, why wouldn't you like it?
Well, I can tell you one thing that Tom and I had over everybody else, because we're both reasonably tall, and if you were short and you were going to do this, you were
better going to be in a farrier.
Arm up there. And with us, it was like this. I mean, a lot of times we looked right into the horse's mouth, and so it made it a lot easier for us.
So eventually they did go to power equipment, which made it easier. But anyway, so that's where I got started in dentistry, and then it kind of just flowed over into cats and dogs after that. And the other thing that really got me into it was when we were at Michigan State University, and most veterinary schools in that era, they didn't teach you anything. So you didn't know anything about dentistry and animals. So you kind of had to go on your own and learn and dive in on things and learn how to do things. And that kind of spurred me on too.
I love that.
How much did he teach him now?
Not much. I mean, there's a few veterinary colleges in the country that actually have a pretty good dental program for their students. And I'm going to say maybe a handful out of 30 schools. But when you and I, Pete, went to school, I think we got one hour lecture and that was it. 1 or 2 hours of lecture and that was it. No hands-on experience. So it was really lacking.
Prior to going on the air here, excuse me, Tom and I talked about it. We think that's probably the most important thing we do as far as improving the health of a dog or cat when we find those patients that really need dental work and do that. There's a couple of things when I started out, we waited till they really got bad, then we dealt with them, which was really stupid. And, it's like, oh, not yet. Oh, not yet. And then finally we said, oh, now's the time to do it. And some of the teeth were loose and we were doing this. It's like, oh, you idiot, you should have done this 2 years ago. But a lot of this time was not yet, because we hadn't really been properly trained. And so
that's right.
It was an avoidance thing. And just as one of those things. And actually, most of us kind of interpret dental work as an unpleasant thing. And I think we've all heard people say, I'd rather get a root canal than do this or do that. And I think that's kind of the mindset of everybody. But you're what they call a fellow, right? A dental fellow.
Yep.
Explain what that is.
So I was a fellow in the Academy of Veterinary Dentistry, and basically I had to go through about a 2 or 3 year program of training. It's kind of on your own, but you have to go to continuing education in dentistry. You have to, do so many procedures over a 2 year period of time. You have to document, your instrumentation, your equipment. And then you have to sit down and take about a 4 hour exam. So, it was pretty, vigorous. And I got through that and became a fellow in 1998. And, it was a lot of work, but in the long run, it was worth it.
Sure.
Mm-hmm. So while we're talking about dental tips for your dog, I actually pulled up common myths that I wanted you to touch on about dog oral health. So when it comes to dogs' dental health, dry food is definitely better than canned food. Myth or fact?
Well, it's mostly myth, a little bit of fact. If you compare dry food to canned food, the dry food might have a little more abrasive action on the teeth when they chew. So maybe that can kind of have a cleansing component on the teeth. But basically, dogs that eat just dry food can have horrible tartar buildup, horrible gum disease, horrible periodontal disease. So it's mostly myth.
Okay. Next one. Animal bones are good for your pet's teeth.
Yeah, this is a real problem because if you walk into any pet store and you look at their chew toys or their chew items that they have for dogs, a lot of them are rock hard. They're bones, they're deer antlers, they're bully sticks that are as hard as a rock. And anything that's firm and has no give to it can fracture teeth. And I would say after periodontal disease, fractured teeth are the second most common problem that we see in dogs mainly.
Okay. Speaking of fractured teeth, what about this one? All fractured teeth needs to be extracted.
Not true. It depends on how severe the fracture is.
Okay.
If the fracture exposes the pulp canal, which is where the nerves and blood vessels are, then that tooth needs to be extracted, or in some cases can have a root canal procedure if you want to save that tooth. But once that pulp canal is exposed, it's going to get infected, it's going to die, it's going to abscess. If it's just a minor superficial fracture, then a lot of times nothing has to be done, or sometimes veterinarians will seal the dentin that's exposed to try to protect it.
Yeah. What about baking soda and human toothpaste can be used to brush your pet's teeth?
Human toothpaste is a no-no because it has fluoride. Mm-hmm. And so when you brush a dog or a cat's teeth, you don't want them ingesting fluoride.
And they don't have a way to spit it out necessarily.
No, they don't spit it out. The baking soda, I think, is the same deal. You know, it can probably kind of wreak havoc with their acid-base balance.
Yep.
Yeah, with baking soda. So you should use a veterinary or animal-specific toothpaste.
I've never brushed my dog's teeth. Are you supposed to?
You should, yeah. Now, you've got labs.
Yes.
And there's certain breeds of dogs that are more prone to dental problems than others. And labs are probably... Smaller dogs. I'd kind of draw the line at 25 pounds and less, definitely.
So it's just guaranteed they're going to have dental problems?
Just about. Yeah,
okay.
Yeah, 25 pounds and less. You've all the little terriers. And,
man, it's a give or take. It's like if you get a small dog, you get dental problems. If you get a big dog, you get joint problems.
Well, that's kind of how it works.
What about a middle of the line dog?
Well,
between 25 and 27. What do we say about that?
But your labs are going to be more resistant to periodontal disease.
Okay.
Maybe not develop as much plaque and tartar than a smaller type dog, but that still doesn't mean you shouldn't brush your dog's teeth every day.
My dog's got a sensitive tooth because she actually chipped it because she grabs ice in the wintertime and like chucks it up in the air. And one time she chucked it up in the air and brought it down and whimpered, and then her tooth was bleeding, but it just kind of sliced it.
Okay, well.
But I never got it removed. It doesn't. She still eats and everything.
Yeah.
It's not. If it's one of the little incisors in the front.
Yeah, it's one of the ones in front.
They're pretty shallow, and so that doesn't.
Well, it depends. If the pulp canal is exposed.
Yeah.
So I mean, usually you can tell that. Sometimes they need to be under anesthesia to tell that because you have to take a little pulp probe to see if you can enter the pulp canal because sometimes it's very small. But next time she's under anesthesia,
we'll check it out.
All
right. Ready for the next myth?
Yeah.
Sure.
An anesthesia-free dental is safe for your pet.
Yeah, there's a lot of controversy with the anesthesia-free dentals. The problem with them is the most important part of a teeth cleaning is subgingival or under the gum line cleaning. That's where the disease starts.
Okay.
And you can't do that in the awake animal. You can't run a sharp dental instrument under the gum line in an awake animal and do a good job of cleaning that area. You can clean the crowns of the teeth, which is fine. That's more kind of cosmetic, really.
So the whole point of not putting them under, is that like a cost thing, or is that just a...
I think it's two things. I think cost, and I think there's a lot of fear of general anesthesia in the general pet owning public.
Okay.
Which I can't, it's not risk-free to put a dog under general anesthesia, but the anesthetic drugs and things that we do make it very, very safe. And I always said that with older patients, that age isn't a risk for anesthesia, that health status is a risk. Mm-hmm. So a healthy old dog, 14-year-old dog, is not an anesthetic risk.
Okay.
I think one of the things we see every once in a while, people bring these little dogs in, less than 25 pounds. They're also the dogs that get heart disease on a regular basis. And so that's the one you don't want to stumble onto, the dog that's on the cusp of having heart failure, and then you anesthetize them. So we do that a lot at work. We'll take a picture of the chest and make sure the heart's normal. It's not a lot of perihilar edema, fluid in the lung field area.
Yeah.
And so I think that's one of the things that happens every once in a while. Clients are going to spend a little bit of money having this done, and they really are reluctant to do the pre-anesthetic work. A lot of them are like, are you sure my dog will be all right? And then what we do, let's take a film and maybe run a 10-screen profile on the blood and see what you got going.
Sure.
And then that gives, so now Tom knows what he's going to run into, or I know what I'm going to run into if we attempt that. And so, these little dogs, especially these Chihuahuas and Pomeranians and stuff like that, I mean, they make two kinds, those that are currently having heart problems and those that are going to have heart problems sometimes. There's a lot of them just developed that at a fairly young age. And I'd have to tell you, I think that there's not an awful lot of Labradors we treat for heart failure every once in a while, but they have to live a number of years sometimes to have the same sort of problems that the little guys have. And I think that's, and the little guys have the collapsing tracheas and they have all that stuff. So,
what do you think has more problems, little dogs or big dogs?
Well, I think they all have problems. It's just different kind of problems.
Yeah, different problems for sure.
Yeah. And that's, I don't think our clients have always thought that when you look at a breed, I mean, if somebody brings a Doberman in, first thing we think about is wobblers and dilated cardiomyopathy. I mean,
what's wobblers?
Wobblers is a laxity in the joint where the head attaches to the spinal cord, and you get some of these big dogs, Great Danes, and really Dobermans probably. Those are the two, number 1 and 2.
Don't Dobermans have the clotting problem too?
They have all sorts of problems.
Really?
Yeah.
I didn't know that.
You haven't got enough paper here to keep the list. So.
Are Dobermans like a high?
Well, they have
high risk?
They get von Willebrand's, which is a bleeding disorder. In fact, sometimes when we're going to do a Doberman, we actually pre-med them with things that release clotting factors before we'll do a hysterectomy on them. Or
wow.
Yeah. Actually, you can do what they call buccal mucosal bleeding time, which and we
what,
used to do
what?
Where you pierce the gum with a sharp instrument, and then you see how long it takes for that gum to clot, those gums to clot. There's tests you can run, but in the old days, we do those buccal mucosal bleeding times, and they were pretty accurate. And that gave you an idea as to...
That's a tongue twister.
Buccal mucosal bleeding times. They make a special little knife that you do that and hit it, and then blood starts coming, and you just time it. How long before it clots? And then you look at your clock, look at your watch, and then determine whether you're...
What's a normal clot time?
You'd like to see them less than a minute or a minute and a half.
Yeah, probably less than a minute.
Yeah. But then when you get them 5 minutes, it's like, whoops. We want to do this. And especially if you're going to take teeth out and stuff. I mean, there's a lot of bleeding, and you got to be able to stop the bleeding, And
that's a terrifying thought, to think that I could take my dog on a hike, and if it brushes up against a stick or bleeds in some way, it could die.
You don't have a Doberman, so you're all right.
I know. But I'm just saying, if Doberman owners out there.
Yeah, well, there's a lot of dogs that have bleeding disorders, but I don't think they're as common as maybe they once were. I don't know. Anyway,
well, you don't see as many Dobermans these days either.
We used to see a ton of Dobermans.
Yeah, it's not a popular breed right now anyway.
No.
Now it's the mini...
The French Bulldogs.
French Bulldogs, yeah.
Yep, French Bulldogs.
And they have problems.
They have problems too.
So many problems.
And really and I think that some of these breeds, they get these breeds started in their family tree looks like a pencil, and I think that then you start to see this happen, more frequently because they're
all related.
Yeah, they're all related. That's right. And you know what? They want to get a certain look, they want a certain feathering on golden retrievers. You want a certain color on a golden retriever. And you start doing that, it's like you going out and decide, well, I think I'm going to get married. I want to have somebody who has the same color eyes as I do and same kind of hair and same sort of build, et cetera, et cetera. Well, next thing you know, you're marrying
You're marrying Ted Bundy.
Well, you're marrying your brother from the orphanage,
Oh,
and
Jesus.
I think that's illegal. At least in Michigan, it is. And
I thought you were getting at character personality traits that are passed down that you don't want.
No, those you get after you're born. So
Oh my gosh.
So you're the way you are because your mother and I. Sorry. and Tom's kids are like Diane and Tom. So
he's so mean. We were sitting on the porch the other day, and he goes, "I just want you to know you got all your good looks from my side of the family,"
which is pretty much true.
I told him the opposite. I said, I think Sharon had a big influence in Molly's
good looks. Okay.
Yeah, phenotype.
I get people all the time that say, "You look just like your dad." And I'm like, I don't know if that's a compliment or not. I guess.
Because you've had people.
He's tall.
You're tall. You're tall.
I just get the fact that I'm tall and I'm a smart ass. Yeah. That's all I got from him.
That's probably where you got it from.
I wear that badge of honor. So, all right, you want to go over a few more myths?
Sure.
Yep.
All right, dogs. I'd never heard of this before. Dogs can give strep throat to adults and children.
Well, it's a bacteria. I suppose technically that's true.
False.
I guess it could happen.
People with strep throat are infected with a group. Oh God, I'm not going to be able to pronounce this. Streptococcus bacteria. Dogs and cats are not natural reservoirs for this group of species of bacteria.
Well, you're right. They may not get it, but it's certainly bacteria. So when you look at the things in general, viral things are very host specific. So who gets, it's like cats don't get Lyme disease. Really, it's not very often, but that's a bacteria.
They don't get parvovirus.
And they do. They get, cats get feline distemper, which is a parvovirus.
Oh, okay.
I don't know if you know that's how we have not seen that in cats in a long time. This feline distemper, and all of a sudden there's a little group of cats up in Eaton County that are showing up with it. And we have to use the dog parvo test to test them for it.
Oh, wow.
Yeah, and so that's how you test it. You do the fecal thing and you run a parvo test for dogs, and that's the way it comes back. It's kind of cool. It's something that is probably in the last 3 or 4 years has been something
crazy.
Tom's actually retired. Are you fully retired now? Or?
Yeah, I'm pretty much fully retired, although I worked on my daughter's dog the other day, did a dental procedure on Huey. So I'll get back into action for my family pets, but otherwise I'm pretty much retired.
Okay.
What do you do in your retirement time?
He's playing tennis and golf.
I'm a big golfer, so that's probably my biggest hobby right now, and eats up a lot of my time.
That's
and
fair.
like being on the water, like boating, fishing, things like that.
Are you going to take up golf when you retire?
I don't think so. I think I already got enough back problems without signing up for more. And I think if you haven't taken it up by this age, you aren't going to take it up.
It's a tough game to learn, that's for sure.
Even when you're 25.
Yeah, at any age, it's tough.
And it's frustrating, and everybody tells us it's a really frustrating game, and I'm trying to figure out, just for the record, I've never played a round in my life, and so I just don't want to sign up for frustrating stuff. I mean, hey, let's go do some frustrating stuff. And then we can drink afterwards, and it's like, and maybe we won't feel bad about ourselves. And you don't do that much, Tom, but anyway, maybe you do. I don't know. Do you have a beer afterwards?
Not very often.
Okay.
If I have a beer once or twice a month, that's about it.
Okay.
All right, I got one more myth for you. Dogs and cats with dental pain will not eat.
True and false.
True and false. Sometimes they'll eat, maybe not eat as well as they should.
This one says false. Pets have a very strong survival instinct. They will continue to eat despite being in substantial pain.
Well, if they got teeth falling out and they can't occlude their teeth. Listen, here's what you see. You see them tilting their head this way. And they're trying to eat it on one side, and good for them, but that means there's something wrong over here because they're using gravity to shovel it over the other side.
Yeah.
And so we see that, and I think Tom and I would agree on this. The nice thing about dogs is they're tough, but the bad thing about dogs is they're tough. They wouldn't come in this room. They would sit there and go, you know what, my mouth's killing me today. You going to do something about this or what? And that's what we see. It's like sometimes I'll bet you opened up mouths and like, wow, I wonder how this dog or cat got along like this. how's it? It's actually fat. How the hell can it be fat when it's got that stuff?
Yeah, I think the proof in the pudding on dental pain is that they're right. I mean, they'll still eat and they're survivors, and sometimes they don't show any symptoms, and then you have them come in and have a dental procedure done, and maybe they've got some severely diseased teeth that need to be extracted, and then they go home, and then you see them back 2 weeks later, and the owner say, "Oh my gosh, I've got a new pet now."
Yep.
He's much happier. He's running around. So, animals hide symptoms, and sometimes it's hard to recognize when there's a problem going on.
We'll see that sometimes when they bring them in for vaccines. It's like, holy crap. We didn't realize our dog was doing so bad. It was like he was 3 years younger when he brought him home after having a dental. And they think the dog's going to come home with these great big ice packs on his head and all drugged up and everything. And they walk out and go home and eat twice as much that night as they ate the night before. I think that is crazy. So, Tom, you know what we do on this program here on Off Leash? We play a couple of tunes every once in a while. And I told Dr. Eberhard that, hey, we're gonna play a couple of tunes. Why don't you pick out something you like? So this is his pick here today. So
this is Puerto Rican musician Jose Feliciano doing a rendition of "Light My Fire."
That the Doors had done probably 5 years prior.
Yep, this would be about 1968 by Feliciano, and he's an extremely talented guitarist.
Yeah, he's always had a sound. Every song he does, I used to say it's like Hootie and the Blowfish. Every song has that same quality as the previous song as far as the voices are concerned and everything. And so, he has a very, very distinct voice. I don't know if you know he's blind. Did you know
No.
that?
He was born blind from congenital glaucoma.
He's wearing glasses in his...
Yeah, that's why.
Yeah.
Because he's blind.
Yeah. Did it win any awards or anything?
I don't know. I think it's one of the best renditions of all time of a previously recorded song. But what's interesting in this song is that he's strumming this guitar. He's not using a pick, and it's.
Could you imagine learning guitar blind?
And when you look at there is a video of it. It's kind of poor quality, but when you look how he strums this guitar, it's pretty incredible.
And he was popular for probably maybe 10 years.
Yeah.
And then does he's still alive, I believe, right?
I think he is still alive, yes.
And he probably still performs from time to time. Who knows?
I don't know, but he's getting up there in years. He's
probably 80.
Getting close to 80.
Here's the original version.
Yep, by the Doors.
Yep.
I've definitely heard this one.
Yep.
It's much different style.
Just for the record, this guy is not alive. He drank himself to death. Jim Morrison. So this was kind of crazy. This almost probably a little bit before your time, but they brought this out about the same year that they were burning the town of Detroit down, and so they had. This is 1967, I believe. And
yeah, it says 1960s.
Yes, and they had all these riots going on around in Los Angeles, Detroit. Detroit had a really kind of famous riots, and
for what?
Just sort of race-related, I believe, for the most part.
Okay.
I don't remember what triggered it, but it was a hot summer, and man, they were having fires. It was kind of cool because I think in the end, the baseball team, Willie Horton and Al Kaline and those guys, Gates Brown, and they kind of went out in the public and said, hey, listen, knock off burning the town down,
Did this song contribute to the fires?
The what?
The fires. Light My Fire.
It was extremely popular. I mean, so you'd have to remember, they'd play the news and they'd tell you about all the fires, and then this would be the song that came on right after the news. And so it's a long rendition. And I think there's still one guy left in this band that's still alive. But this kid was he was in acting school, I think, at USC or UCLA. I don't remember, one of those two. Probably UCLA, and he was a poet and everything. He never really sang very much, and then he put this group together that he was in class with, and they became who they were.
This was a huge song.
It was a huge song,
yeah.
And then of course when Jose Feliciano did it afterwards, it was a huge song again. I don't know if it ever hit number one. It probably hit number one in '67. Whether it hit number one in '68 or '69, I don't know. But anyway, kind of a fun song.
This one's much more techie.
Yeah, well, this is not acoustic. Yeah, so, but anyway, that's a blast from the past. You were probably in about 8th grade when that all came out. I would think.
12 years old.
Yeah, 12 years old. Do you want to tell us about your girlfriend? Or you want to let that episode slide by?
Not much to tell.
Okay, very good. That's the right answer.
We can talk about Pete's girlfriends.
No, we're not going to do that. We're going to do that. No, we're not going to do that. And anyway, Tom probably had did you know Diane when you were in high school?
No, I met Diane at Michigan State.
Oh, did you? Okay.
Mm-hmm.
Okay.
Yep.
So when you were mature, sort of.
Yeah. I was in veterinary school.
Oh, you were mature.
Yeah.
Well, sort of.
Yeah.
You were probably a very, you're really academic. Tom and I have this thing when we get together, we play veterinary Jeopardy with one another. And so we share things we've learned and that we know. And I think that's really kind of a fun thing. I have another friend, Tim Zorn, up in Frankenmuth.
I know Tim.
Yeah, Tim. And he and I call him, we play veterinary Jeopardy with one another. And so I think that's always been kind of fun, the camaraderie of being a veterinarian. I mean, we're all, and we're like a lot of professions, we argue with each other about certain little things. We could agree 90% or 98% on something, but we'll argue about the 2%. And which is really all right, because that's the way you learn. If something you're doing or saying is wrong, certainly Tom could correct me on the dental stuff. I'm not sure what I correct him about, but you get the idea is that we learn from one another. And then really, quite frankly, once we learn from each other, we actually steal it from each other and then call it our own. But that's still fair play in my estimation. I think that once you get out of school, and clients should know this, that we learn from the time we get out of school. We learn every day, every week, every month, every
day is different.
Every day is different. Every day's, and then what we have experiences. We take those experiences and we put them in our head someplace. Yeah, and we apply them, and then we're like, and then when we go and see it the next time, I mean, we have a better rendition for clients as to this could be what happens, and this might be what happens, but anyway. Other things I was going to talk about, I think one of the things that I see clients doing all the time is they're trying to brush their dog's teeth and it's all covered with plaque. And that's kind of silly to do that. Go ahead and tell me what you think of that.
Well, once the plaque is on the tooth surface, it can't be brushed off. So it has to be mechanically cleaned off with dental instruments. And I mean, you can still brush a dog's teeth that has plaque and it might slow down the progression of that, but it's not going to remove it. So, a good time to get committed to brushing your dog's teeth is after that teeth cleaning, and, get committed to doing that.
How often would you do that?
Once a day.
You brush your dog's teeth once a day?
I sure did. Yep.
I can barely brush my teeth once a day.
Well, you need to do that.
Oh my God.
Too.
No, I'm just kidding. I do brush my teeth.
Listen, for the record, Tom was very fastidious about his own pets, and he had a dog that had kidney failure, and I think he kept that old dog going for
15 and a half years.
Yeah.
Wow.
Well, and I think in the last year and a half was with advanced kidney disease. Yeah. So I've always admired Tom. He's one of those people that doesn't tell you what to do and not doing it yourself. You know
right.
what I mean? I think that's one of the hallmarks of good veterinarians. They do the things that they suggest people do. Mm-hmm. And so we've enjoyed that relationship with each other. And I would always call Tom when I had a question, and it would always be, okay, what about this, Tom? What about that, Tom? And then we talk. Then we talk about the football team after that, and then we talk about the basketball team after that, and then in the interim, I might even think of something else to ask him. But he was always a really, really good source of accurate information and practical information. I think a lot of times we see veterinarians giving recommendations that are way over the top and
right.
stuff. And
well, here, Molly, I'm going to give you a pointer on brushing teeth about doing it once a day. So, do you take your dogs outside for walks every day, or no? Or you just let them out the door?
No, I take them on walks. I mean, we go out to the training grounds all the time.
Yeah. So we took our dog Riley a little rough-coated Jack Russell Terrier out at night before bedtime, took for a walk. And so that's when I would brush the teeth. I had to get off the couch to take Riley for a walk. So I go back in the mud room and pop her up. She was only 8 pounds. So pop her up on the counter and brush her teeth. And then we go for a walk, and then it's bedtime. So it's not like you're doing that much more. Mm-hmm. And if you start doing it once a day at any age, but if you start early when you first get your pet, they like it. Mm-hmm. They know what's coming. They know what's coming before the night walk, and they like it. They don't fight it, and it's quite easy. It takes you about a minute. Right. Easy peasy.
I feel like it'd be hard. What do you get, a squirt bottle and then squirt around where the toothpaste was?
No, you just leave it in there. The toothpaste is meant to be eaten or swallowed.
Do they like the taste of it?
Oh yeah, they have all different flavors.
Malt and chicken and stuff.
Yeah, I like the vanilla mint.
He likes it like he's tried it.
Just the way it smelled, but they have chicken flavored and beef flavored. I had the vanilla mint, they called it, But yeah, you just go in and brush the outside surfaces of the teeth. You really can't do a very good job on the inside, but most of the plaque and tartar are on the outside surfaces.
Toothbrush, hard, soft bristles.
Kind of soft bristles. They make veterinary toothbrushes, or you can use a human toothbrush. That's a soft bristle brush. Yeah.
Okay. Well, I think that's true. I think that when I get clients that do that, and you see them year after year after year, and they tell you what they're doing, I mean, they don't really usually need dentals because they've done everything somebody's asked them to do.
Well, the thing that I tell the clients with the dogs and cats are hard to brush, I must say that, but we're talking dogs here. I say, well, if you do this every day, then you won't have to have the teeth cleaned as often. Still probably going to have the teeth cleaned, but instead of every year, maybe it's every year and a half, maybe it's every 2 years, maybe it's every 3 years. Like on a lab, it could really stretch out because they're not big plaque tartar producers anyway.
Okay. Follow-up question.
Okay.
Are the greenies, are those bullshit?
I think greenies have some benefit for abrasive action on the teeth.
Because I feel good giving it to my dog. I'm like,
I think that's fine. I think it's got some benefit, but the gold standard is brushing the teeth once a day. And all these companies that make these products to help keep teeth clean, they're trying to get around brushing the teeth. And you can't get around brushing the teeth if you want the best dental care.
Okay. Good to know.
So if you were going to pick a veterinary product that people feed their dog, what would you pick?
Well, I think the foods, the dental diets have some benefit.
TD?
The TD, I would use TD. I think that has definitely some benefit.
Tooth diet, TD.
Well, maybe we can eventually, with Voyager down the road, look into making a tooth diet that's not prescription.
We could see what happens. Yeah. They may have patents on their stuff and everything. I don't know.
Do they?
Yeah. Probably do. Kibble design.
And I think it's we have some people that get TD, but not very many. I mean, and somehow or another, it just never really caught on because we've had it around for 10 years or 15 years maybe.
I think feline TD is a great diet. Like if I had a cat, I would feed it feline TD for the dental benefit. And it also has the urinary tract health benefit too. And so I would do feline TD. I think that would gain traction. I agree. The canine TD really hasn't gained traction all that well. But I'm kind of puzzled why the feline TD hasn't.
Well, on the canine TD, correct me if I'm wrong, and I might be wrong here, but is it not when dogs eat the big ones that they fracture and you get a fair amount of it on the carpet and everything, or not really?
Well, yeah, the kibble's designed to not crumble. The tooth impales it's a large kibble too. It's a real big, and that kind of scares people how big it is to give their dog. But it fractures up the tooth surface, and that's a mechanical action on the tooth surface. And it probably could be a little messy.
Well, that's what I've heard clients complain about. Oh, I don't like it on my carpet, and in our place, the dogs would eat whatever was on the carpet if it spilled out like that. But a lot of people's dogs just leave it there, and so that's, you know how this is. It's you get pushback.
Yeah.
But let's talk a little bit about, we haven't talked about this yet, x-rays on your dog's teeth.
Okay. Yeah, I think that's a trend that's becoming pretty common now, where just like with us, when we go in to have our teeth cleaned, oftentimes once a year we'll get our teeth x-rayed or radiographed, because more than half the tooth in the dog is below the gum line in the bone with the root structure, and you can't evaluate that without a dental x-ray. So if you are a veterinarian and you've started taking dental x-rays or are going to, you'll be amazed on how many problems you'll find on the x-rays that you would never recognize otherwise.
Right.
So it's a very valuable tool to evaluate dental health.
If you do the x-rays, what you do is you go around, you fix everything that needs to be fixed today. And if you don't do the x-rays, you'll go around and do it
Until you see a problem?
Well, no, a year later when those lesions have become gone
Surface.
from small to being magnificent, and then that's the issue. So think the Titanic and the iceberg, because that's really kind of what you're looking at. The tooth sticking out of the thing. It's still like the canine tooth on your dog is probably at least twice as long, or maybe not at least twice as long.
Well, the root of the canine tooth is much bigger than the crown of the canine tooth, for sure.
So
Speaking of canines, I just went to the police training program.
Yeah.
They cap all those dogs' canine teeth with titanium.
Just normal canine teeth, they'll cap
so
them?
they do it as a preventative now. So because they're
that's
like,
interesting.
the dogs bite so hard that they'll break their canines.
They'll break their canines. I saw that a lot. And
Yeah.
a lot of times they come to me for like a root canal procedure because the pulp canal was exposed. And then I'd put the titanium crown on or cap on the tooth after it was repaired. But they're trying to preempt that.
Yeah.
That's,
to keep the bite strength.
Well, that's interesting. Yeah, that's
Nothing is more
thing.
intimidating, because I put on the bite suit of a dog like right next to your face, and you see like the gold teeth.
Yeah. That's an interesting idea to do that. To prevent them from breaking, because they would break them commonly.
Yeah, because they said that they had somebody do it. They normally do the capping on zoo animals. Some specific zoo animals. I can't remember which ones.
Oh,
I want to say like
tigers
cheetahs and stuff like that, because they have good jaw strength too, and
sure,
they'd break them off.
Yeah, and maybe in captivity they're more apt to grab on things, metal things.
Yeah.
Well, they got
bars,
metal
cages.
things keeping them in. Yeah, sure.
Yeah, so they did it. So then the police canine dogs started going and getting their teeth preemptively.
Was that the Battle Creek City?
They come from all over. So it's an event that they put on where they come from all over Michigan.
Okay. Yeah.
But I was looking around and I was like, why are all these dogs have like gold teeth? Because it looks gold.
Yeah.
And they're like, yeah, we cap them with titanium.
That's an interesting idea. It sounds like it would work. Yeah, it would help.
Because I guess once they break a canine, the bite strength goes down to like 60% or sometimes 50%.
Well, they become less functional as a police dog. Yeah, if they're compromised there, for sure.
That's crazy work.
Hard to grab the criminal without canine teeth.
Yes.
We went out to fairgrounds and we rode in the car, and the driver jumps out, starts running, and the dog goes and gets on him. He's running in the suit and everything. It's like, and they're like, "Do you want to do that?" No, I think I'll pass on to it next.
I got to wear the suit.
Did you?
It hurt.
Does that bring back bad memories? No, I've never been chased by a police dog before. So anyway, I just act like I have. That's all.
I'm surprised with your college stories.
Yeah, I know. Yeah, they put you in prison for all this stuff we did in college now. And my son comes home from Michigan State, and that's what he said. He says, "You wouldn't be in school, Dad. And in fact," he says, "you might even be in jail." And I'm like, really? College is no fun anymore. So we're going to tell you what we did, but nobody died. Let's just put it that way. So
That's good.
Yeah, that is good.
But did you die?
Yeah, did you die? Anyway, anything else you want to talk about, Tom? Think that this is really for the listening audience. As far as Misconceptions, I think that's the thing I'm the most concerned about, that people walk in with this misconception of what's going to happen or why it's going to happen. And one of their questions is, why is it so expensive to clean a dog's teeth? And we have to tell them there's a lot of preemptive work. We set catheters and we completely anesthetize them, et cetera, et cetera, et cetera.
Yeah, I mean, there's a lot to it. They just can't sit in a chair like we do and open their mouth up. So, there's an IV catheter, there's fluids running during the procedure, there's general anesthesia involved. Oftentimes, depending on the patient, there's pre-anesthetic blood testing done to check kidney and liver health. So it's kind of a big procedure. And the other thing too is that when our patients come in for a teeth cleaning, they have a lot more plaque and tartar than we do. I mean, it's a major job to clean all these teeth. And I'll tell you a real quick story. I had a periodontal human dentist that was a client of mine that was just down the street from my veterinary clinic. And one day he said, if you get a real bad periodontal case, I'd like to work on it, And I said, okay, I'll get one for you and let you know. And I did. So he came in and we got this patient anesthetized, and it had this huge periodontal defect, or what we call a periodontal pocket, on the inside of a canine tooth that was about, 6-7 millimeters deep. And so I'm showing this area to this periodontist, and he gets in there with his periodontal probe and looking at it, he says, "Holy shit." It's like the biggest periodontal defect he's ever seen in his life, and this dog was like 8 pounds.
Oh, wow. Well, it is. It's an entirely different business. We didn't talk too much about resorptive lesions in cats, but cats get these things called resorptive lesions, which are like little holes in their teeth, and then the gum kind of comes down and tries to
kind of band-aids it.
Band-aids it, yeah. Mm-hmm. And those cats are anesthetized. I remember the one time the cat's completely anesthetized, and I touched that little resorptive lesion with a dental pick, and the cat's back legs are,
they can feel it even under
general anesthesia. So we take those teeth out generally, and those cats are really happy to see that go away because But Tom and I would probably agree on this. They just don't come in and complain about crap all the time. And I think the other thing that, and I'm sure Tom did a really good job on this, is that it didn't say, "Oh, I think you should clean your dog's teeth." And Tom would be, "When do you want to clean your teeth? Tell me what day." Mm-hmm. And then so it's not that you're bullying your clients, but you're acting as advocate for the dog or for the cat, and that's what we do.
Which is what we're all about.
Yeah, and I don't want clients to think, well, this son of a bitch is just trying to create enough money so he can keep his kid in school. That's not it at all. I don't think we ever did that, ever. Whatever our financial needs were, and we'd just come in earlier if we had financial needs. We didn't ever talk people into doing stuff they didn't need to have done. And I think that's, I want you to, and I don't think veterinarians as a rule ever do that. So I think you're going to have to kind of look at that and go, and I think if your clients trust you, they'll do what you ask them to do. And I think Tom was probably really good that way. I've never been in, I watched you work a little bit when you worked for us, but I'm sure when you got really good at doing the dental stuff that you could make a compelling case for why you want to do what you want to do.
Sure.
And it isn't what you want to do, it's what we should do. Here's what we should do. Always try to include the client in there. So here's what we should do. The dog, the client, and the veterinarian, here's what we should do. And I think that the dog would probably send you a tip, or the cat would send you a tip after the dental for, "Hey, listen, thanks a lot for talking the old lady into doing this," because it's a...
Yeah, and some of the times the things that we battle is the time interval, because we might see a patient for a routine exam, vaccinations, whatever, and suggest that the teeth be cleaned and that it should be done now rather than later. And maybe the next time that we see that patient, it's a year later. Well, a year is a long time for a lot to happen.
Yeah.
And things get really bad in a year. And a couple of my favorite sayings in practice with the people that I worked with, veterinarians and technicians, so forth, is I said, well, really, it's never too early to clean teeth, one. And then if you're extracting a lot of teeth on your patients, you're not doing a good job. You're waiting too long.
Waiting too long until it gets to the point of no return.
That's right. Yeah. And it is a point of no return. You know,
Right.
once you lose that bone structure and support of that tooth, it's gone. It's not coming back.
Yeah, exactly.
So this is about the end of this, but I want to tell you, I think what's going to happen to you, Tom, is your wife's going to watch this probably, see how you did.
She was asking me, she
She's
says,
gonna watch this.
when is it on?
Well, I'm going to tell you where the pitfalls are. Tom said he had a mudroom. And I know Tom's wife, Diane. She's an impeccable housekeeper. She's going to be really PO'd when she finds out he referred to a room in their house as a mudroom because you don't have any mud in your mudroom. Is that correct?
That's
Okay.
correct.
Well, you go home and defend yourself. Good luck doing that. If she goes to the end, she'll see me making fun of you, and that'll probably gloss it all over for her. But Tom does not have a mud room. He has a room which he keeps his shoes and some
That's off the garage.
and his winter coat. No mud room. Sorry, Diane. I can't watch him all the time.
Well, you ready to get some outro music going?
I'm ready to get some outro music going. See, this is a damn good song right here.
Who sings it? 10 points if you get it right.
I got it. Okay, let me.
Oh,
Smokey
come on, Tom.
Robinson?
No.
Marvin Gaye.
Marvin Gaye.
Okay, I was close.
Yeah, you were close.
I was close.
He's in the Motown label. You got that part.
Yeah.
Anybody could have got the Motown part. Yeah, Marvin Gaye.
Well, good thing we're not quizzing you on music
You know Marvin
Jeopardy.
Gaye died, don't you?
Yeah, I heard that. Yeah.
His dad shot him.
Really?
Yeah.
Wow.
All right. Well, let's wrap this up. We sure appreciate you guys listening along with us today, and we've been able to share some information that will help you love your animals as much as they love you. Don't forget, always treat the treatable and prevent the preventable. We will catch you guys on the next one.
Good job, Tom.
Yeah. Nice being with you, Pete and Molly.
Thank you.